Have you ever pondered over the history of cancer treatments and wondered about the role of a seemingly bizarre concoction known as Coley's toxin? This question leads us into a fascinating journey through the annals of medical history. The battle against cancer has seen an array of treatments, from the traditional surgical removal and radiation therapy to more modern approaches like chemotherapy and targeted therapy. Each of these methods, while effective, comes with its own set of drawbacks and side effects, such as debilitating fatigue, pain, and even secondary cancers. In this complex landscape of cancer treatment, a unique approach emerged in the late 19th century, thanks to the tireless efforts of Dr. William Coley. This approach, both intriguing and controversial, involved the use of a specific bacterial concoction known as Coley's toxin. In the midst of all these treatments emerged an unexpected player, Coley's toxin. So, what is this mysterious Coley's toxin and how did it come into existence? Let's journey back to the late 19th century. Meet Dr. William Coley, an eminent surgeon at the New York Cancer Hospital. Coley was a man with a mission to find an effective cure for cancer, a disease that had claimed countless lives, including his father's. In the course of his practice, Dr. Coley stumbled upon a peculiar case that would forever change his approach to cancer treatment. He came across a patient who had undergone a remarkable spontaneous remission of cancer following a severe bacterial infection. Intrigued by this unexpected turn of events, Coley wondered if there was a link between the infection and the disappearance of the cancer. He began to delve into medical archives, searching for similar cases. His relentless pursuit led him to a series of cases where patients with malignant tumors who had also suffered from bacterial infections showed significant improvement or even complete remission. This pattern was too consistent to be a mere coincidence. Fueled by these findings, Dr. Coley embarked on a daring venture. He hypothesized that inducing a controlled bacterial infection could potentially trigger the body's immune response to fight off cancer. To test this, he developed a concoction of heat-killed bacteria, which he named Coley's toxin. The application of Coley's toxin was a radical concept. By injecting it into the tumors, Coley aimed to incite a feverish response, provoking the body's immune defenses to not only attack the bacteria but also the cancer cells. His early experiments showed promising results, with some patients experiencing tumor shrinkage and improved health. Coley's toxin was a groundbreaking discovery, a beacon of hope in the grim landscape of cancer treatment. It was a bold step forward, a testament to Dr. Coley's innovative thinking and unwavering dedication to his mission. And thus, Coley's toxin was born, promising a new dawn in cancer treatment. Now, you might be wondering, how was this toxin used and what was its impact? Well, let's delve right into it. Dr. William Coley, after developing Coley's toxin, began to administer it to cancer patients. He believed that by injecting the toxin directly into the tumors, he could stimulate the body's immune response to fight off the cancer cells. Over the course of his career, he would treat over 1,000 patients using this method. The clinical efficacy of Coley's toxin was nothing short of remarkable. Many patients who were given a grim prognosis saw substantial improvement in their condition. Some even experienced complete remission. But it wasn't a one-size-fits-all miracle cure. The treatment worked wonders for some, while others saw little to no effect. The efficacy of the treatment depended largely on the type of cancer and the stage at which it was detected. Sarcomas, lymphomas, and certain types of skin cancers responded particularly well to the treatment. However, cancers like breast and prostate cancer showed less promising results. Now, let's talk about the challenges. Administering Coley's toxin was no walk in the park. It required precise injection into the tumor, and the patients often experienced severe side effects including high fever, chills, and body aches, akin to the symptoms of a severe bacterial infection. And there was no guarantee of success. But despite these challenges, the successes of Coley's toxin were too significant to ignore. It offered hope to those with no other options, and it paved the way for the development of modern immunotherapies. In the grand scheme of things, Coley's toxin was a crucial stepping stone in the fight against cancer. It illustrated the potential of the human immune system in combating this deadly disease and inspired a whole new approach to cancer treatment. Coley's toxin was indeed a game changer, but it was not without its challenges. And as we'll see in our next segment, the research and development of this revolutionary treatment continued. shaping the future of cancer therapy. How has research on Coley's toxin evolved over the years? This question takes us on a fascinating journey through time, from the late 19th century to the cutting-edge laboratories of the 21st century. In the early years, Dr. William Coley himself spearheaded the research on Coley's toxin. He meticulously documented his findings, recording the reactions of over 1,000 cancer patients who were treated with his toxin. Despite the promising results, his work was met with skepticism. Many doubted the efficacy of the treatment due to the lack of controlled clinical trials and the unpredictable nature of the toxin's side effects. Fast forward to the late 20th century, science had advanced, and researchers started revisiting Coley's work. They began to understand the principles behind Coley's toxin, how the induced fever and infection stimulated the immune system to attack cancer cells. This realization marked the beginning of a new chapter in cancer treatment immunotherapy. Today, Coley's toxin is regarded as the precursor of modern immunotherapy. While the actual toxin is no longer used, its underlying concept has been adopted and refined. The toxin essentially kick-started the immune system, encouraging it to recognize and destroy cancer cells. This is the same principle used in many of today's immunotherapies. Researchers are now able to create targeted treatments that can train the immune system to specifically identify and eliminate certain types of cancer cells. They are also exploring combinations of immunotherapies to increase their effectiveness and broaden their applicability. The journey of Coley's toxin is a testament to the power of scientific persistence. It's a story of how an unconventional idea, dismissed by many, has eventually shaped the landscape of cancer treatment. So, while we might not use Coley's toxin today, we owe a great deal to Dr. Coley and his pioneering work. From its humble beginnings, Coley's toxin has indeed paved the way for modern cancer treatments. As we continue to unravel the complexities of the immune system and cancer, who knows what further insights we might glean from this intriguing chapter in medical history. What does the future hold for Coley's toxin? As we delve into the realm of possibilities, we find scientists and researchers tirelessly exploring the potential reutilization of Coley's toxin in treating cancer patients. The medical community is buzzing with the promise of this century-old discovery. Imagine a world where cancer is not a death sentence, but a condition that can be managed or even eradicated through the power of immunotherapy. The potential benefits are staggering. Yet, like any formidable endeavor, it's not without its challenges. The complexity of the human immune system and the unique nature of each cancer type present obstacles that require innovative solutions. Nevertheless, the potential of Coley's toxin continues to inspire and drive research forward. So, while the road ahead may be fraught with trials, the future of Coley's toxin looks promising. As we stand on the cusp of medical advancements, Coley's toxin might just be the key to revolutionizing cancer treatment yet again.